The Centre for Remote Health's one of a series of university departments of rural health. There are 11 of these across the country. There's also a network of rural clinical schools. So in Australia we have this rural and remote academic infrastructure that's really the envy of the world. The Centre for Remote Health's a little bit unique in that it focuses on this discipline that we call remote health. So we're really interested in those very small, very isolated communities that are dotted across the inside of Australia, that 80% of Australia. What the HWA programs have enabled us to do is to build on existing infrastructure to really enhance that in a significant way. So for example, we've been able to build the simulation labs here at the Centre for Remote Health, which has really enhanced our capacity and the quality of the sort of training that we can do. We've also been able to facilitate upgrades at clinics like the Central Australian Aboriginal Congress so that they are now enabled to take more of our students and have better training facilities there.
Our health service delivery area for Congress is Alice Springs and a 100-kilometre radius of Alice. When you go further remote, it's been really difficult to recruit and to some extent retain GPs in a situation where you've got a very sick community, while at the same time not having the appropriate infrastructure to support those health professionals. So to have these extra rooms made available enables us to just build on that quality education program that we've got.
Med students can use this, our remote area nurse students can use it. You can have multidisciplinary teams in on something. You can stage scenarios that can either be a clinical setting, or we can actually make it that it's more about communication.
It is a tough work environment. It's tough physically, it's tough mentally, and it's tough professionally for those health practitioners working in very remote communities. We need to have better strategies of how to train doctors and nurses and allied health professionals and Aboriginal health workers together so that we're producing team-ready graduates that can go out and work in these remote areas and in rural areas, and I would argue in metropolitan areas, in fully functional, effective teams.